Hello everyone. In this video, we're going to discuss planning projects. This can apply to both our class projects as well as overarching health communication campaigns and interventions of all kinds. So we're going to learn a lot about both of these things, but the information here will help you with your final projects and the proposal that's coming up due really soon. Now, I want to begin this discussion by considering some of the best practices that the textbook introduces to us. They have that whole section in the beginning before they get into the planning process, talking about some successful campaigns in the past and if there are some generalizable lessons. This is probably worthwhile. We're not going to go through all those case studies, but I think it's good for you to keep these lessons in mind as we go through the rest of this whole discussion. So, number one, we're talking about audience-centered communication when we're talking about health communication, because there's a lot of context we have to consider and a lot of individual characteristics that we have to consider. When it comes to patient-provider medicine, that is very individualized care. That's kind of the whole point. That requires you to get to know the audience. But when we're planning an intervention, the same principle applies. We're not going to be nearly as effective if we don't take the time to consider the audience and the situation in which they are going to encounter the message, including their attitudes about the health issue. Additionally, successful interventions should invest in communication infrastructure. By that, we don't mean like the kind of infrastructure that's like your internet cables. What I mean here is, does your intervention provide mechanisms for feedback in the future in terms of evaluation and improving the intervention if it's going to continue to go in the future or if you're going to continue to make new interventions in the future. But there's other more practical examples as well. You could think about, again, with patient-provider communication. If we're trying to improve something like that, well, then you need to be designing a project that's going to help develop relationships between the patient and the provider. But likewise, if we're doing a public health intervention, we need to facilitate relationships between the key groups, stakeholders, providers, researchers, politicians, all those people. And so when we say invest in communication infrastructure, it means cultivating those relationships and interactions and ensuring that the intervention can pay dividends going forward. Now, another good lesson that we could take away from some of those case studies in the beginning of the chapter is to make healthy options accessible. Make them easy, right? Make the right choice, as it were, easy on the audience, right? If you're trying to get someone to change their behavior, you want to make it as easy for them as possible because that eliminates some of the barriers. They discuss this in the textbook in relation to, like, well, in the supermarket, do you make the healthy choices, the produce section? Does that come first or does it come after the bakery? Well, doing so, making that decision influences people's health choices accordingly. It's also, interestingly, a ethical consideration, right? So if you put a bunch of baked goods right at the door and hungry people come in and buy a bunch of donuts, well, that's an ethical choice. But so is kind of, passive aggressive signs or something saying eat more fruit. But all of these things have to be considered, and that's another one of those big picture kind of considerations for the whole thing going on here. Likewise, another best practice here would be to use a multimedia approach. As we're going to see, different media channels have different advantages, of course, that's intuitive, but they're also going to have different audiences that they're better at reaching. They're going to have different impacts. They're going to have different reach. They're going to have different accessibility. And so using a multimedia approach in terms of a health program or intervention can be helpful in that it will allow you to target specifically more key groups in different ways. Now, I think this is probably one of the most important ones here towards the end is setting clear goals and measuring success. We're going to talk about that a lot in this lecture, but despite talking about it a lot, you need to keep this in mind for your projects, not because we're going to have an actual evaluation implementation. We're not going to get to those later stages, but you do need to plan for them. And so part of your project should have built-in measures of success. We don't need to actually measure the success per se, but you need to know how you would measure the success. And we're going to talk about that when we get into the objectives and goals of the projects. I like to always put this example up. This is a ad I saw long ago on a gas pump trying to get me to buy premium gasoline, probably circa, like, I don't know, 2015. But we've got the cartoon engine block here, and it says, dude, it's like a performance drink for your car. Seriously. There's a reason I keep bringing this example up throughout my career as a professor, and it's because it just strikes me as so patronizing. You could maybe try to use your imagination. What demographic is this targeting? Right? Who are they trying to get to buy premium gasoline? Young people? Well, that sounds pretty patronizing. It seems like it's written for, like, I don't know, 17-year-old kids who drink a lot of Mountain Dew and play Call of Duty in the basement. I don't know who they're targeting here. But it also brings to our attention one of the important differences between marketing and health communication is that with a marketing situation like this, we don't really know who they're trying to reach, but it could be a very, very specific group, and it could be they're targeting that group just to get them to increase their profit margin just a little bit, just a hair, right? It doesn't have to be massive. Well, the goals are a little bit different in health communication. We're trying to help a specific group deal with specific health issues. So it is targeted in that way too, but we have to consider perhaps the repercussions of using patronizing or tone-deaf messaging like this, because if you turn people off to the message, that's a problem too. Not necessarily a problem for marketing. Well, it is there too. That's a separate matter. But perhaps not as serious as long as you're having some success. Now, let's think about some of the key steps here. Now that we've looked at some of those general recommendations and best practices, we can give them a little more context too, going through some of the other content in the textbook and elaborating on these things to help us make more sense of that. Now, this figure you're looking at here is not coming from our textbook. This is coming from a different health communication textbook, but I like that it illustrates something particular about the planning and implementation process, and that is that it is a cycle. And so you have the planning stage where you're you're doing research, you're doing audience analysis, you're doing situational analysis, you're building a structured approach, you're building strategic processes and objectives. Then you also have the implementation, right? We're probably not going to get to that step in this class. You're welcome to, of course, try and implement your project, but that's not a requirement here. But after implementation and monitoring, you also have these feedback and evaluation mechanisms built in that then feed back into further planning. And any good health campaign is going to have mechanisms to do that. This isn't just like throwing a dart out there. All right, one and done. We're good. Good job, team. We spent a bunch of money. We planned out a bunch of stuff. I don't know if it worked or not, but that's good enough. No, that's not good enough. When it comes to public health, we need to be vigilant. We have to keep working on things, and we have to have feedback mechanisms. Now, the textbook is giving us specifically 7 steps to use in our planning process. And I'm probably going to compare to this other textbook a little bit as well. Don't worry about that for the sake of exams or anything like that. But I do want you to see how different health communication scholars conceptualize this stuff and order it differently. But at any rate, the steps that Dupre is giving us in our textbook begin with defining the situation and the potential benefits of your intervention, followed by analyzing and segmenting the audience, establishing campaign goals and objectives, selecting communication channels. That's about as far as we're going to get for now, at least in the proposal stage. The remaining 3 steps have to do with designing campaign messages and executing that plan, as well as the evaluation. Now, by the time you get to your final project, you're going to need to have considered those parts of it as well, even though we're not going to actually enact the plan. Now, this lecture is going to focus on the first 4 steps because these are the most relevant to your proposals. It's also in these first 4 steps that you see some differences between this textbook and other textbooks. This is more an interesting aside than anything else for your purposes, but we can talk about that. Even if they're a little different, the same goals need to be accomplished in the planning process. But let's compare this to another example. So this is again coming from a different textbook, and all I really want to show you here is that they have slightly different steps, right? They have the preliminary analysis of the overall program goal, the outcome objectives, followed by doing a situation and audience analysis, and establishing communication objectives specific to targeting that group, and enacting specific communication strategies, coming up with that tactical action plan, and having an evaluation plan as well. So the only real difference here is that, well, they in this particular example, they like to put the audience analysis in with the situation analysis because considering all that context involves the audience, but focusing on just the audience is not enough, right? We have to look at the big picture. And so maybe that's useful for you to keep in mind. But these early steps here, as you can see in this progression, they're very similar to the other steps. And more than anything, in terms of thinking about this being a one-way street, remember that this is a cyclical process. And so you may be revisiting different things as you go along. The most important thing that we have to deal with, first and foremost, is establishing what issue we're tackling, and then getting a realistic picture about that issue, getting a realistic picture about who it affects and how we're going to reach those people. So, step one, define the situation and the potential benefits of your intervention. And consider whether your efforts are likely to be successful. Specifically, are they realistic? We should consider this early and we should consider it often. Are we being realistic in our goals? Are we being realistic in our plan? Are we being realistic in our evaluation? Because health communication is so applied, we should be asking ourselves this question all the time. Are we being realistic, and what can we actually hope to accomplish? Is our intervention actually based on solid evidence? That's really important too. The science never changes. The scientific method doesn't change that much, right? It is meant to be an objective process. However, the results that we get out of the science, we get new data all the time, right? So in that sense, the science does change sometimes. I don't really like that expression for obvious reasons, as you can see. However, we need to be responding to the most current evidence and the best evidence that we have. This is not going to be successful if we're flying by the seat of our pants, so to speak, and just, I think this thing's a problem, so I'm going to target that thing. That's not good enough, right? We have to understand the health issues to the best of our ability. Along these lines, as we're defining the situation and the potential benefits of our potential intervention, we want to think about what has been done before. Right? Have people done projects like this before? Who participated at that point? Who was resistant to the message at that point? What is going on now? What are the strengths and weaknesses of those existing campaigns? And what kind of attitudes do people have about them? Dupre is putting this in the first step, considering this. The other textbook I showed you just a moment ago, the Schiavo textbook, they put this step later on in terms of more where you're considering the communication channels. And either way, you're going to want to think about it then, and you're going to want to think about it here too. So what has been done and what lessons can you learn from that? Regardless of how you do this, make sure you do it, right? We want to think about this at some point in the intervention, look at what has been done before and what has worked and what hasn't. So more than anything, it is really important for you in your very first stage to establish what the health issue is and what health behaviors can mitigate that issue. That's paramount in the project planning. So before you even figure out what your goal is, you need to understand what health issue you're talking about. What are the factors in obesity? Okay, if the health issue is obesity, we need to understand that. What health behaviors make that better and what health behaviors make that worse. That's all part of this first step, defining the situation and potential benefits. So when you look at your proposal templates, you're going to see that. I've got it right up front. You're going to have to establish what is the issue and describe it in greatest detail that you can. That combined with the audience analysis will end up making up much of your analysis papers later on. So the more of this you do now, the better off you're going to be. If you don't do much of it now, you're going to quickly see why Dupre is putting this in the first step. Now the second step is audience analysis, according to Dupre. And as I've said multiple times already, other textbooks put this in with situational analysis. Some people separate it out. One thing's for sure, regardless, you need to consider the big picture in order to better understand the audience itself. So first, do you have enough information to assess who your primary and secondary audiences ought to be? What are our primary and secondary audiences? Well, the primary audience would be who the issue primarily affects. So we've established our health issue, and we want to know who is most likely to suffer from that. So for example, if we're talking about older Americans at risk of dementia, that's pretty straightforward. There we go. We know who our primary audience is. Now, through our definition of the situation, we may have learned that regular sleep can help stave off dementia. Well, that's good. Maybe that's something that we've kind of got in our mind to investigate as we go along, and we let that shape how we're going to address these different groups. So maybe that's something that we can consider, particularly when we think about the secondary audience. That might be anyone else who can influence this directly or indirectly. You could think about this in terms of health belief model and interventions, government, friends, social support, whatever it may be. And sticking with this current example, this might be the family members who can influence the routines of older Americans, such as encouraging more sleep or offering instrumental support, such as like, all right, I'll do the housework, you go to bed, mom, that kind of thing. Um, that would be maybe the secondary audience. And so as we go forward to think about our intervention, we're going to be like, all right, well, we know the people are most at risk. Those are who are going to be in our primary audience. But there are a lot of people who can influence those people in their health decisions. They become our secondary audience. This isn't the only thing we need to consider when we're talking about audience analysis, however. I wanted to take a moment here and show you again from a different textbook, from the Schiavo textbook. This is the key steps of a situation analysis. And I bring this in here because they argue that the audience analysis is just one part of the situation analysis. Again, regardless of that, you're going to need to do kind of all of this at some point. A principal difference here is all of these steps that Schiavo is giving us have to do with not just trying to understand our audience. It has to do with interacting with our audience, because a lot of these public health interventions and health communication textbooks are very focused on what we call community-based research. So the steps in this plan, for example, identifying key groups, stakeholders, and constituencies, understanding the social, political, and other determinants of health, and then developing, sharing, and discussing an audience profile and segmentation report. That all then feeds up above into highlighting unmet communication needs and interacting with those key stakeholders later on. So now we can see lots of different steps here. A lot of this we've already talked about, so I'm not terribly worried about which order you do these things, but I want you to recognize the complexity of this process and how many different things you probably ought to be considering. On the right side of this image, you have kind of the research phase, and on the left side, you have kind of the data discussion and analysis, which may or may not involve the stakeholders. But usually, if we're doing this out in the real world and we're trying to do some public health stuff, we want to involve those key groups and stakeholders. That will help us, again, establish an audience-centered message and a hopefully more successful intervention. So some scholars combine the audience analysis and the situation analysis, and it looks something like this. Dupre kind of splits this into the first two steps, right? Defining and understanding the health issue, for instance, that's in step 1, and then the audience analysis they propose as step 2. At some point, you're going to need to do both. So again, the audience analysis, the purpose here is to make a message relevant to a specific group. If you try to make the message relevant to too many people, you might end up making it relevant to no one, right? So if you try and reach everyone, you may not reach anybody. And so we do have to be more targeted than that. Think about lessons that we may have taken from public speaking or something. If you're trying to persuade people, you need to think about who your actual target audience is. If you are trying to convince people to donate more blood, it doesn't do you much good to tailor your message to people who will never donate blood, who are just terrified of needles. Like, that doesn't do you any good. However, if you tailor your message towards people who are on the fence, then you're more likely to have the most success. So keep that in mind, also applying that here in the audience analysis. We're not trying to reach everyone about dementia. We're trying to reach people who are at risk from dementia. That's a specific target group. Now, we also want to be able to segment that audience, not just based on primary and secondary audiences in terms of who's most at risk and who can help those people. We can also consider this in terms of attitudes that people have about the issue and perhaps the health behavior, as well as stages of openness to behavior change. By that, I mean something along the lines of social judgment theory, which we can get into next. So social judgment theory is just one of many theories. It's an old one and it's a good one because it's one of these theories that is considering how people process information. Who is likely to pursue what action? Why are they likely to do that? Who is likely to resist that action? And why should we care? Because part of our situational analysis is thinking about who is going to be resistant to that, right? What kind of barriers are we going to encounter here? Well, the social judgment theory, just very briefly, is outlining how difficult it is to persuade people to something that they feel very strongly against, for instance, right? That would be a total conversion of an opinion. That's usually not the goal of persuasive messaging because it's very, very hard to do that. However, there are degrees of things that people can agree with or agree with minimally, and you're much likely to have more lasting change if you interact on those points rather than on something that people totally disagree with. So we can think of that in terms of our persuasive messaging. We can also think of that in terms of audience groups, right? If your audience members, if your key group is somewhere really far on the strongly disagree side of things with your message, you're going to have to tailor your message in such a way that it doesn't seem like so big of an ask, if that makes sense. One last theory I'd like you to consider when thinking about how to segment our audience is a stages of influence theory that's been well established in social sciences. Another way we can think about how people process new information is through this diffusion of innovation theory. So what this looks like is thinking about the stages people are at where they're willing to adapt new information. You've probably heard of this before as a description of how different personalities adapt to new information, tech, behaviors, etc., at differing rates. So the main tenets of this theory are recognizing that there are multiple stages of awareness, right? So step one would be awareness of an issue. Step two would be knowledge and interest in the issue. Step three would be making a decision based on that awareness and knowledge. And four would be trial and implementation. Five would be confirmation or rejection of the new behavior. Now, we can go through all these steps, and that's important too. So if you're segmenting your audience, thinking about what stage they're likely to be in terms of this message. So if we're trying to target older Americans and reduce their risk for dementia, well, which stage are they at? Right? That's one way to segment that audience. Are they more at the awareness stage or are they more at the decision-making stage? If we're trying to encourage a vaccination campaign, are people pretty well informed about that vaccine, or do we need to give them more information so that they can even make a choice? Are they interested in this choice? Are they at the stage where they have to either confirm or reject that behavior? Well, knowing that about your audience is a great way of segmenting them to tailor your message more specifically to them. This other image here, which is also coming from that other textbook so you haven't seen this before, but this is what you may have heard about the diffusion of influence theory. You have the innovators who adapt things earliest, you have early adopters who are next in line, and so on, going all the way up to laggards who are very far behind in terms of whether or not they're likely to adapt to new information. I don't think that is necessarily as useful as the stages of awareness for you, but I'm providing it here so that you have a little bit of context about this theory because it is a rather popular theory and it has some interesting implications. We don't have to think about that too much other than if we can identify attributes of that audience. This is one more way in which we can create this kind of audience profile. Now let's take some time to talk about program goals and objectives. This is step 3. Now other models separate these out and maybe we start with the program goals and deal with objectives later. What we need to know is that program goals are what you're actually trying to do, right? Reduce the number of people dying from a given condition, for instance. The objective would be more concrete. It's how you're going to meet that goal and how you will know you've met that goal. Let's break these down one by one and discuss both. Program goals, starting with that. Well, the first step here is to have a program goal or program goals and be clear about that. You want to be clear about that at least to yourself, if no one else. You should be clear about that to everyone else too, but at the very least, you need to think about what you are trying to accomplish. That is essential. Now, to help you along with that, we have some interesting terms here that you've probably heard before and may not be familiar with. First one up here, morbidity. Is your goal to reduce the prevalence rates of a given health condition? That's what the term morbidity has to do with, whether or not you have a given health condition. Related is the word comorbidity. You may have heard that before. That has to do with coinciding health conditions. So do you have diabetes and you are classified as a heart health risk, right? Comorbidity, diabetes and heart disease. That would be an example of that. But morbidity has to do with whether or not and how prevalent the actual health condition is. Mortality, on the other hand, well, that's death. That's pretty straightforward. These two terms can be a little confusing, though, if you don't know the difference. Morbidity is the occurrence and prevalence rates. Mortality is deaths associated with that given health condition. Not all health conditions lead to death, and there are other steps along the way before death, and that's why you have both of these terms as considered for health interventions. Incidence, that would be the number of newly diagnosed cases per a specified time period per a specified population. Right? This is important as well. Establishing the incidence of a given health condition helps us better understand how big a problem it is. And we have to have a specific and narrowed scope when we are assessing all of these, but in particular incidence. These are epidemiological terms that help us better characterize an actual problem. And it helps us get to a specific goal. So we can't really have meaningful program goals if we don't deal with an individual specific problem. To that end, we need to have a certain level of expertise, or at least understand some of these definitions. An additional one here is the quality of life. If we're talking about outcomes, desired outcomes, we would hope it would improve either a physical, psychological, social environment, or all four of these kinds of aspects, these domains of life. A health intervention could be targeted at specific ones of these if there's specific domains, if there are specific problems with those domains. But ideally, a health intervention should improve all of these and detract from none unless absolutely necessary. Now, the outcome objectives. Once we have a sense of that goal, well, the goal is distinct from the objectives that we use to measure that goal. So the textbook is talking about behavioral, social, and/or organizational objectives, meaning behavioral, what are we trying to get people to do? Social, what sort of processes or changes do we need to instill in the population and/or in the organization? What kind of policy changes do we need to have? Do we need some best practices to change? All of these, of course, depend on the population you're talking about and the problems you're trying to solve. But regardless, those objectives should complement the program goal. We have that program goal and then we can try to reach it. Reducing morbidity, the incidence of this, perhaps. Well then, that gives us a specific goal. How do we reduce the incidence of a given illness? There's a lot of different answers. Those answers should be research-based and they should complement the program goal. But again, they should be research and evidence-based. That is essential. They should be validated and supported by the research phase of the planning side of things. You shouldn't have an intervention, a goal, an objective that is divorced from what the research tells you. If you cannot acknowledge what is happening to the best of your understanding, well, it doesn't really matter if your intervention is, well, it doesn't matter if your message is persuasive or not. The intervention's not going to be helpful. Now, we also want to ask ourselves, and this question is going to become even more important as we go along, but are your objectives measurable? How do you know if you have succeeded? Well, ideally, you would want to have an outcome objective that can be measured, that can be viewed, and can be assessed. If it cannot, again, not only do you have no way of guaranteeing that your intervention was successful, but you're going to interrupt that process, right? We should be researching, we should be measuring, we should be evaluating the success of our outcome to guarantee future success. Now, how do you do that? Well, we'll cover this a bit more later, but it doesn't hurt to have you start thinking about it now. Incidentally, your final project in the class is not going to be contingent on some objective measure of success, but in your proposal in the project yourself, you should have an indication and give it to me as to what you think a measurable, successful outcome would be. So keep that in mind as we go along. Now, regarding objectives, this is a little bit more specific than the goals, as I mentioned before. This is how your intervention is going to specifically address those goals. And here's a fun acronym that can help you do this. This is also coming from a separate textbook, but I think it's simple enough and useful enough that we can use it to evaluate a wide range of objectives in our programs, and I think it'll be useful to you as well. So this is a simple model for developing your objectives for your project. The S here stands for specific. Is your objective specific to the program goal? That's important. It's also important to be specific to the population and the cultural context. All that stuff should be considered here, but it should be specific, right? If our goal is to reduce transmission, our objective should realistically be able to be expected to reduce the transmission, right? We don't just slap things together and expect like, maybe it works, right? That's not what we're doing here. Your objective should be specific. If not, it's going to be wasteful and it's going to be ineffective. It should be measurable as well. When we pick an objective, we're talking about, well, reducing morbidity or mortality. Well, that's a big goal, but like, how do we measure an objective associated with that? Well, if the goal is to reduce the morbidity, well, then we are talking about the transmission rate. We are talking about reducing the transmission, and we should be able to measure that mathematically, quantitatively, hopefully. Qualitative information is really useful for developing interventions. It's useful for developing theories, but it's not going to be as useful for what we would refer to as hypothesis testing. We want to know if there is an actual relationship between what we're doing and what the outcome is. That's where the measurable comes in. So usually we're talking about quantifiably measurable. In epidemiological sense, there are specific protocols that you can follow to measure this. Do you need to be epidemiologists to do that? No. However, you should pick objectives that can be measured and have some sense as to how that occurs. It also needs to be appropriate to the audience, both culturally and in terms of their attitudes and beliefs. However, also appropriate to their level of risk. Not all issues have a uniform risk. If we go to our previous example of dementia, well, most young people your age are not at risk for dementia. There are things like early onset dementia, but still not really in your wheelhouse, right? So it wouldn't make sense to target an intervention towards you unless you're the secondary audience and we're trying to get you to care more about the issue. That's separate. But again, in that case, the message and the objective should be appropriate to who you're trying to reach specifically. A lot of things have stratified risk. COVID-19 is one of those things. Many respiratory illnesses, things like that. There's stratified risk, different groups at different risk. Now, your goal should also be realistic. Remember that keyword that we mentioned earlier. We're never going to entirely eliminate, well, pretty much any health issue, right? We're never going to entirely eliminate respiratory illnesses. It's not a realistic goal. We're never going to entirely eliminate obesity. It's not a realistic goal, right? So we want to be grounded and realistic in those goals and have a clear understanding. It was never a realistic goal to stop COVID-19 entirely, right? Usually isn't an objective, right? So but we want to make sure that we do have our feet on the ground in terms of what we're trying to accomplish with our specific objectives here. Now, the T here stands for time bound. Our interventions should have clear timetables. If they don't, then it's just kind of a free pass for whatever may happen, and that's not a recipe for success. If you want a successful objective, it should be related to all of these different criteria. It should pass these criteria of the SMART kind of acronym, and I hope you find that useful as you go forward to develop your own goals and objectives. Now, step 4 in Dupre's process is figuring out what communication channels are going to be most useful to you. So based on your audience segmentation, your goals, the issue, the factors that lead to that issue or contribute to it, what channels are going to be best for this? This is another point where considering what has been done before is going to come in handy. We want to know what kind of programs exist already, what's been successful in the past, and what we can expect to be successful going forward. So in particular, I want you to consider things like the channel characteristics. By a channel, I mean, are we using the television? Are we using pamphlets? Are we using posters, YouTube videos, apps? Phone calls, whatever. These are all different communication channels. And they all have varying characteristics, such as the reach of the channel. How many people are you able to contact given that message, given the channel? How many people are able to receive that message? The specificity of the channel. If you want to think about how this works, think about targeted ads according to Google, right? They're managing they're monitoring your browsing habits, and then they use that to tailor ads to you. That's what cookies do on most websites, right? Back in the olden days, before the internet was the main way we got all our information, and we still have this, television, right? If you look at different channels, you see different commercials for different demographics. And it's always an interesting exercise to flip on the TV if you still have access to network television. And go to Cartoon Network, see what commercials are there, what kind of toys, what age level are they advertising? Are they advertising more to girls or boys? And this changes all the time, of course, based on cultural trends, based on political trends, based on products, movies, whatever is in the vogue, right? All of that affects how marketing messages of any kind are targeted. Now, health messages, similar idea here. Think about how what channel is going to reach what people, what channel is likely to reach your target audience, your key group. Now, another characteristic of channel is impact. Impact we divide in a couple of ways, usually into arousal and involvement. Arousal, like it sounds, is emotional arousal. This could be excitement. I mean, you could think of it in terms of sexual arousal if you want. Sometimes that's important too, sex sells, whatever. But we're talking about something a little bit broader than that when we say arousal. We're talking about emotional arousal, a state of excitement. People tend to be risk averse. Therefore, they experience more emotional arousal when they're exposed to risk messages or, scary things, right? This makes fear appeals fairly useful or powerful. But fear appeals only work if you give people something to do about it, right? You can't just make people scared. You have to give them an action to take. But at any rate, that has to do with arousal. Now, when it comes to assessing the impact of your message and your intervention, think about how if you're trying to encourage people to do something fairly benign or boring, it may not grab their attention. Go figure, right? And if you're competing with other more exciting messaging, that could be another potential barrier to your message. But at any rate, we're talking about impact. We're talking about how emotionally aroused people are in response to that message. We're also talking about how involved they are. How relevant is the message to them? When we say involvement, we mean that. How relevant is that message to the audience that you're addressing here? More relevance usually leads to more what we refer to as elaboration, per the elaboration likelihood model, which is another theory used to describe social influence and persuasion. Elaboration simply means, is the audience likely to think about that message and engage with it? So when we say elaborate, that's what we mean. Are they going to elaborate on the message in their head? Well, impact is often assessed based on levels of arousal and perhaps involvement of the audience. Either way, these are things you really want to consider. Now, multiple channels can increase all three of these. So remember that earlier best practice we mentioned in establishing that you could have a multimedia campaign, and that can increase all of these. It can allow you to increase your reach. It can allow you to also be more specific in that reach with different messages on different channels, and it can improve the impact by targeting people in a relatively distraction-free environment, etc. You get the idea here. But this is why that best practice exists. Multiple channels can increase all three of these things. So consider that as you evaluate what kind of intervention to make. Now, when you get to the end of your proposals, you are only required to provide some ideas at this point. You don't have to pick one just yet because we're still going to do more planning and analysis before we settle on a final actual intervention. But do consider the different channels based on what you know about your audience and your issue at this time. Let's look into planning example here. One of my go-to, well, of course, this is the most prescient, relevant example of the time is COVID-19. I'm always a little bit nervous to talk about this because, well, there's a lot of politics around this right now. And even as a health communication person, I have to be sensitive to that so that I don't get in trouble, right? But it doesn't matter what we're talking about. We can still evaluate it objectively based on these criteria. Now, in pandemic situations, a lot of these rules tend to go out the window, and that's a problem, actually. I don't think that we should change the criteria by which we evaluate our interventions because of, well, how important the importance of the message is factored into this process. And so if we decide that because it's a pandemic, we don't need to have measurable goals or realistic goals. Well, what's the point, right? All of these things are more important in a pandemic situation, not less. But let's look at COVID-19 as an example here. We can break this down a little bit, and we can try to evaluate some of the objectives that we can see publicly based on the criteria that we've just discussed. So the major program goals with something like this kind of pandemic or infection, respiratory infection, or any kind of public health crisis like this, usually we're talking about reducing morbidity and reducing mortality if it's particularly deadly, right? So again, morbidity would be the frequency with which it occurs, the amount of cases, and mortality would be deaths associated with this particular health condition. Now, those would be goals, right? They're still vague. They're targeted and they're going in the right direction, but they're still a little bit vague. So the objectives would be associated with that. An objective for reducing morbidity, for instance, would be to decrease the transmission of COVID-19. Reducing mortality, well, if you're trying to do that, you're trying to decrease the severity of the illness if someone catches it, right? Now, how do we do that? So if we evaluate those objectives, then we can evaluate these objectives based on the SMART criteria, right? We could say, all right, our objective is to decrease transmission to reduce morbidity of this condition. So decreasing transmission, is that a specific goal? Yes, that's specific. Is it measurable? Well, yeah, we should theoretically be able to measure the occurrence in cases. Now, epidemiologically speaking, it's kind of a page one consideration to acknowledge that there's always going to be more cases out in nature and in the environment than we are actually measuring. And so epidemiological practices have ways of assessing that, right? Recognizing that limitation. But still, we can measure some things, and we should. So yeah, sure, this is probably a measurable objective. Is it appropriate? To answer that question, we have to learn more about our audience. The fact that the attempt to decrease transmission was not very targeted might be a little bit of a red flag. Are we trying to, is that appropriate? Well, it's probably too broad, right? Which also bleeds into the next criteria here, which is it realistic? Is it realistic to decrease the transmission of respiratory illnesses? Sadly, we don't have a whole lot of evidence of interventions working to decrease the transmission of respiratory illnesses short of reducing contact, right? So if you live in isolation, you're less likely to contract a contagious disease. But short of that, it's kind of hard to evaluate these things. Now, time-bound, this might be the most notorious criticism leveled against most of the COVID interventions in terms of saying, well, it wasn't time-bound. We go all the way back to, all right, just locking down for 2 weeks to slow the spread, and then it went on and on and on and on and on, and they keep moving the goalposts, so to speak. Well, that's a problem, right? That's a problem for a public health intervention because as more time goes on and you don't have a concrete plan, you're going to lose people's trust. As we've discussed in the past, that's one possible problem here. But we're illustrating why objectives should try to meet these criteria. If your strategy is not working in the given time frame, you need to change your strategy, right? Not the time frame. And if you do need to change the time frame, you should have some new evidence to suggest that that's an appropriate thing to do. Now, we can extend this to think further on down the line here, because once we have our objectives, we also have to think about strategies in terms of actual strategies and tactics, action plans to address those objectives. And I would like to apply the same SMART criteria to those strategies as well, because things don't lose the need to be evaluated just because we're moving on to the next step, right? So strategies for these things. If you're trying to reduce morbidity, decrease the transmission, well, we can stretch our memory back to some of the strategies that originally arose when we were talking about COVID-19, masks, vaccination, social distancing, and we can try to evaluate each one of these individually. Reducing mortality by decreasing the severity of the disease, the only real option there that people are considering anymore is vaccination or also natural immunity. If you have prior infection, that is a pretty major deterrent. I think statistically, the current evidence shows that that is by far the strongest protection, assuming you don't suffer any complications from the infection itself, right? But there are other options, other ways to decrease severity. You could have treatment options, right? There's been a lot of debate about that when it comes to COVID-19 as well. For now, why don't we focus this discussion on the vaccines in particular? That's been the most persistent strategy. It's been the most talked about strategy, and we continue to gather new information about how efficacious this is and what, if any, dangers there might be associated with the vaccine. So when I talk about the vaccines, the COVID-19 vaccines, and I tailor this discussion, I am specifically talking about the mRNA or messenger RNA inoculations that are pretty much the only recognized option now. I think Novavax is still another, which is I think a sinus spray. But at any rate, most of the time people are talking about mRNA, which incidentally is a fairly new technology, which complicates things as well because we're not entirely sure how these things behave yet. Okay, but if we want to try and evaluate this based on the SMART criteria, for instance, let's take the example of a vaccine mandate. And we could think about this in terms of the executive order saying everyone's got to do this, or we could think about it in terms of some universities requiring their students to get this particular vaccine. Is it specific? Let's start with that. If a university asks their students or requires their students, or if an organization requires their employees to get this specific vaccine, is that specific to the issue? Well, vaccines are tailored to the given health condition, right? They are made unique to each virus. That you would think that's fairly specific. Okay, that's a pretty specific strategy. Okay, is the objective of reducing transmission, is that still measurable at this point? Yeah, actually, introducing an intervention like this, we should be able to have pretty clear measures, at least over time, as to whether or not having a certain percentage of the population vaccinated against the illness actually slows the transmission. Is it measurable? At this point, it seems like that is not as successful as we would hope. The vaccines have not done as much to slow the spread or transmission as we would like. A lot of people have opinions about why that is. Well, everyone's got an opinion about why that is, but that's kind of a separate consideration. At this point, we can see that that has not worked as well as we would like. So then maybe it's time to revisit the strategy. Is it appropriate to the population? Well, now we get into the sticky bits here, right? The stratified risk of respiratory illnesses is a consideration, or at least it's supposed to be a consideration for public health. Is it appropriate to the population? Is it appropriate to a university setting to require the students to get the vaccine? Well, college-age people are not at statistically significant risk from this. It is a stratified risk. They are at less risk than older adults, for instance. Older adults, we're also seeing less efficacy in those groups too, and so there's still some question marks here as to whether it's worth it at all, but that's separate. There is a stratified risk in terms of the mortality or morbidity for the disease. So is it appropriate to the population? Well, we could make a strong argument to say that requiring college students to do this is not appropriate to their individual risk. The secondary goal, which is where most of the messaging has lied, was that it's the socially responsible thing to do by to argue that this would decrease transmission. But as addressed previously, there's not a whole lot of evidence that that is actually working very well either. So is it appropriate? It might fail on that criteria. It may not be appropriate to the population, and furthermore, it may not be realistic in terms of decreasing the transmission of the disease itself. So we're starting to fall apart a little bit here in terms of the SMART criteria, in terms of whether it's appropriate or realistic. The time-bound aspect of this, I think that is also a criteria that we fail here in terms of the booster campaign, which, speaking of moving goalposts, that seems to move all the time, right? And there's not a clear reason or justification as to why or when this is likely to stop or anything along those lines. Well, that is that's uncomfortable from a public health perspective to continue to pursue a specific course of action when the evidence does not continue to support it. And so we can see the more specific we get in our intervention, in our objectives, the the more these SMART criteria apply, I would argue, right? Because we have some clear examples of what we're trying to deal with. And if they don't match up to the SMART criteria, then it's probably best to go back to the drawing board and revisit the research, start new interventions, start new plans, whatever it may be. There are emerging concerns, ongoing concerns about not just the efficacy of the vaccines, but people are very nervous about the dangers of that. Now, regardless of whether or not there are dangers, the concerns are serious enough that they should not be dismissed out of hand. That's another part of this whole process, and that we revisit our interventions as we go along as evidence emerges. And so I'm not comfortable dismissing those concerns. Hopefully, they're not true, right? Nothing really that is not terribly dangerous. You would hope that that's the case. However, that's a serious enough concern that people should evaluate it. But regardless of whether or not this particular intervention is dangerous or is particularly effective, what we can see by applying the SMART criteria is that it can and should be objectively evaluated if we want to have a successful campaign. Again, regardless of the efficacy or danger, it should still be a well thought out and executed plan or campaign. But I've clearly talked about this topic long enough. I hope you find that interesting or useful. I'm happy to discuss these things further, but for the most part, I think this lays out why the SMART criteria are useful, and at the very least, having objective criteria to measure our intervention is essential. If we don't do that, we may not only fail in terms of persuading people to a specific outcome, but we could make a condition worse. We could have not the desired effect, but there's a reason why these protocols exist, so that we can maximize our efforts and the impact of our campaign. So hopefully this is enough to get you going on your proposals at this time. I want you to think through the processes by which we are evaluating, not just planning the intervention, but also going to evaluate it going into the future. Can we be specific, measurable, appropriate, realistic, and time-bound in those interventions? The more you're able to adhere to those criteria, the better off you will be and the more successful your campaign will be. All right, until next time, take care.